All right, this week we're talking about the digestive system. The digestive system has a few functions. The first one we're going to talk about ingestion, so the intake of nutrients through the mouth, eating, drinking. Then digestion. Digestion starts right away, mechanical and chemical breakdown of those nutrients you've ingested, so chewing, and then the breakdown through chemicals, saliva, acids, things like that in your stomach. Next, we have absorption. Absorption of nutrients, essential nutrients, vitamins, minerals, energy through the intestines, absorbed into the bloodstream. And then finally, elimination. So the elimination is removal of the solid waste, things that we didn't use. So pooping it out. Here's a nice picture of the overall view of the digestive system, some organs of the digestive system. So up top here, we have the mouth. The mouth is the opening in which food or nutrients are inserted into the digestive system. It's where it all starts. Your tongue consists of muscle attached to the posterior region of the mouth, provides movement of food for mastication. Mastication is chewing, directs food into the pharynx. The pharynx is your throat. For swallowing, a major organ for taste and speech. The palate separates the nasal cavity from the oral cavity, so it's that hard plate above on the top of your mouth. Soft palate is the posterior portion, so in the very back. Um, not supported by bone. Hard palate is in the front, and it is supported by bone. Uvula is a soft V-shaped structure that extends from the soft palate, directs food down the throat. The pharynx performs the swallowing action, passes food through the mouth into the esophagus or the throat. The esophagus is like 10 inches long. It's a tube that passes from the mouth, extends all the way down into the stomach. Peristalsis is muscular movement, wave-like movement that propels food in a certain direction, which is down. Your stomach is a J-shaped sac that mixes food and stores food. It secretes chemicals for digestion, hormones that act locally to control digestion. Cardia is the area around the opening of the esophagus. Fundus is the proximal domed portion of the stomach. The body is the central portion of the stomach. The antrum is the distal portion of the stomach, and the pylorus is the portion of the stomach that connects to the small intestine. You have a pyloric sphincter, which is a round muscle that opens and closes to allow food to pass down out of the stomach into the small intestine or the duodenum. Your small intestine is 20 feet long. It extends from the stomach, the pyloric sphincter, all the way down to the large intestine. Digestion is completed in the small intestine. So all of your absorption of nutrients happens here. Duodenum is the first 10 to 12 inches of the small intestine. Next, you have the next is the jejunum, second portion of the small intestine. It's 8 feet long, and then you have the ileum, which is the third portion of the small intestine. So starts off duodenum, jejunum, ileum. After the ileum, you move into the large intestine. This is where absorption of water takes place. In the large intestine, you have the cecum, which is the first portion, the colon, which is the main portion of the large intestine, and then the rectum, which is the final portion that extends down to the anus. The anus is a muscle sphincter area that provides elimination of solid waste. Some accessory organs of the digestive system, not seen on this picture here, but first off, you have your salivary glands, which produce saliva. They flow out into the mouth, and saliva is like a liquid that has chemicals in it that aids in the movement and digestion of food or nutrients. Your liver is this picture here. This big organ is your liver. Serves many functions in the body, but as far as digestion, it produces bile. Bile is needed for the emulsification of fat or the breakdown of fat. And you have your bile ducts that bile is transferred or transported through into the digestive small intestine. You have your gallbladder, which is that green sac there that stores bile that's produced by the liver, so it can be released when needed. You have your common bile duct, which is the portion that connects after the gallbladder and liver bile cystic ducts. You have your pancreas, which is this yellow organ that's kind of seen in the back here. The pancreas serves many functions as well, but some of that is the release of digestive enzymes. Enzymes are needed to break down carbohydrates, fats, proteins. Um, and then some other structures not seen on here. The peritoneum is a serous sac-like lining of the abdomen and pelvic cavities. The peritoneum encases basically all of the digestive organs. Your appendix is a small pouch which has no function in the digestive system, but it's attached to the cecum. It can become inflamed or infected. That's known as appendicitis. It's a common ailment that needs surgery. Um, this is a visual image of the pathway of food. So enters through your mouth, obviously. This is pretty easy. Then passes through your mouth, past your tongue, into your pharynx. Your pharynx is your throat. You have a naso, oral, and hypopharynx. The top of your throat basically moves down into your esophagus, is that long tube that connects down into your stomach. Your stomach stores the food for a while. It kind of moves through peristalsis and starts the digestive breakdown. Then it passes into your small intestine, duodenum, jejunum, ileum, and then your large intestine, cecum, colon, rectum, where it's finally solid waste removed through the anus. Some of the combining forms you'll need to know, definitely not all of them, so look through the book. There's a lot more. Ano is referring to anus. Colo or colano is colon. Duodeno, the duodenum. Entero means intestines. Esophago, esophagus. Gastro or stomato are referring to the stomach. Ilio is referring to the ileum. Oro, mouth. Procto or recto is referring to the rectum. And abdomino is referring to the abdomen. Appendo, appendix. Cholangio is a bile duct. Cysto is a bladder. Glosso is the tongue. Hepato is referring to liver. Litho means stones. Linguo is tongue. Pharyngeo is pharynx, or the throat. Some suffixes and prefixes for this chapter. A, prefix, we're talking prefixes. A is absence or without. Dis is painful, abnormal, or difficult. Hemi is half. And here on the other side, we have some suffixes. So seal is hernia or protrusion. Itis, inflammation. Lith, stone. Megaly, enlargement. Oma is a tumor or swelling. And pepsia is referring to digestion. All right, there are many disease and disorder terms. They're all pretty interesting in this chapter. Here are a few of them. Appendicitis, very common. Inflammation of the appendix, typically requires surgical removal. Cholecystitis is inflammation of the gallbladder. And cholelithiasis is gallstones, condition of having stones in your bladder. Often those two things can go together, cholelithiasis and cholecystitis. Colitis is inflammation of the colon. Diverticulitis is inflammation of a diverticulum. A diverticulum is a small little outpouching or herniated area of the intestine. Dysentery is a painful, inflammatory intestinal disorder, typically accompanied by bloody diarrhea, severe abdominal pain. Gastritis is inflammation of the stomach. Hepatitis is inflammation of the liver. Hepatitis can be caused by a number of things, like ingestion of toxins, or viral hepatitis like Hep A, B, C, D. Pancreatitis is inflammation of the pancreas. Pancreas secretes digestive enzymes, so when it becomes inflamed, those digestive enzymes actually start to break down the pancreas itself. Celiac disease. Celiac disease is a malabsorption syndrome where the immune system reacts to gluten, so people can absorb gluten. Causes a number of signs and symptoms like abdominal bloating, diarrhea, constipation, vomiting, weight loss. It can actually damage the intestinal lining. Cirrhosis of the liver is a gradual chronic destruction of the liver cells that form scars. Scar tissue can be caused by things like hepatitis or alcoholism. Crohn's disease is a chronic inflammation of the intestinal tract, typically the ileum and the colon, characterized by ulcerations, cobblestone ulcerations, Scar tissue formation leads to intestinal obstructions, bleeding, all kinds of problems. Gastroesophageal reflux disease, also known as GERD, is an abnormal backflow of the gastrointestinal contents, characterized by like acid reflux symptoms, pain, can break down the mucous membranes in the esophagus. What else? Hemorrhoids. Hemorrhoids are swollen and distended veins in the rectum or anus, which are called internal if they're in the rectum, or anus, they can be external hemorrhoids. Can be a cause of rectal bleeding and pain. Irritable bowel syndrome is a periodic disturbances of bowel function such as diarrhea, constipation, or both, and abdominal pain usually. Obesity, excessive body fat, which increases body weight. It's a condition known as a body mass index of greater than 30. So someone is overweight. And ulcerative colitis is a disease characterized by inflammation of the colon and ulcer formation within the colon, associated with severe abdominal pain, bloody diarrhea. Surgical terms: abdominocentesis is a puncture to aspirate fluid from the abdominal cavity. Appendectomy, surgical excision of the appendix, very common procedure. Cholecystectomy, excision of the gallbladder. Colostomy is the creation of an artificial opening into the colon through the abdominal wall. So someone has a problem with their colon, maybe colon cancer, and they need to divert the contents of the intestine. So stool will exit through this opening in the abdominal wall. A gastrostomy is the creation of an artificial opening into the stomach through the abdominal wall. So this is probably done for a person who cannot eat or chew or swallow or pass nutrients through their stomach or esophagus. So there's an opening and they can give nutrients directly into the stomach through tube feeding, like a G-tube, a gastrostomy tube. Ileostomy is creation of an artificial opening into the ileum, so the small intestine. Same thing so stool can be diverted out of the body through the abdominal wall. Uvulopalato-pharyngoplasty, or UPP, is a surgical repair of the uvula, palate, and pharynx. This is typically done to treat sleep apnea, obstructive sleep apnea. And anastomosis is a connection by joining two structures. So it can be like blood vessels or parts of the intestine can be reconnected. Bariatric surgery is a surgical procedure to reduce gastric capacity, to make the stomach smaller, to treat morbid obesity. So somebody who's overweight can have a bariatric surgery. Typically, it's going to be a gastric bypass, a gastric sleeve, or a gastric band. Diagnostic terms continued. Colonoscopy is a visual examination of the colon using a camera. Esophagogastroduodenoscopy, more commonly referred to as an EGD. It's like an upper GI visual exam of the esophagus, the stomach, and the duodenum, so the first small intestine. Laparoscopy is visual examination of the abdominal cavity. Fecal occult blood test is a test for blood in your stool. Helicobacter pylori, or H. pylori test, is for a certain bacteria that can lead to peptic ulcers or ulcers in your stomach. Some complementary terms for this chapter: a gastroenterologist is a physician who studies and treats diseases and disorders of the stomach and intestines and associated organs. Nasogastric refers to the nose and stomach. Sublingual is under the tongue. Ascites is an abnormal collection of fluid in the peritoneal or abdominal cavity. Emesis is vomiting. Hematemesis is blood in the vomiting blood. Hematochezia is bloody stool. Melena is dark blood. Dark stool is related to blood in the stool. Feces is stool or poop. Stoma is a surgical opening. And lastly, some abbreviations: IBS, irritable bowel syndrome; GERD, gastroesophageal reflux disease; UC, ulcerative colitis; EGD, esophagogastroduodenoscopy; ERCP, endoscopic retrograde cholangiopancreatography; GI, gastrointestinal; N and V is nausea and vomiting.